Welcome to the Delighted Customers Podcast. I am so glad you're here. We challenge conventional thinking about customer experience because I believe that improving experiences isn't just good for business. It's a powerful way to make a meaningful difference in people's lives. Each week, we feature thought-provoking conversations with industry thought leaders from a variety of backgrounds, offering unique perspectives and actionable insights. Get ready to sharpen your leadership and transform your approach to customer experience. Let's dive in. Dr. T, welcome back to the Delighted Customers Podcast.
Thank you so much, Mark. It's a pleasure, and I want to thank you for having me back on the show.
Yeah, so in your first episode number 102, which remains one of our audience's favorites, you really connected the dots between compassion and measurable outcomes. Today, I'd like to build on that episode that we did just over a year ago and explore what's changed since then, a little bit talking more about not just the science and the why, but sort of the how, the practical application, how it shows up in our everyday lives, and maybe what it means for leaders even outside of healthcare. Does that sound okay?
Absolutely.
All right. So before we dive back into this, I highly suggest you go back and listen to that episode because it was packed with gems, and I really mean that. Even going back, and I'll just bridge the gap here a little bit. To share, I guess I would view it as sort of, I don't know, serendipity, if you would view that as how you even got into this jazz, right? You were studying the impact of things like resuscitation and CPR and how it affected the brain and how much oxygen is best in the brain after something like a resuscitation. And then you were asked to get into this research on compassion, right?
Yes, it was my colleague and co-author, as well as a collaborating researcher, Dr. Anthony Mazzarelli, or Dr. Maz, as we say. He was chief medical officer at the time, and he said to me, he called me to come into his office, and he said, I need you to take the topic of patient experience, and I need you to science this up. Now, he was my boss as the chief medical officer, but way back in the day, he was my intern. Okay. So we have a long relationship. And so it was just the two of us, so I could be quite candid. And I said, are you crazy? There's no way I'm going to do that. Like, I do actual science in the ICU. And, we had a conversation, and it was clear that this was not a suggestion for my consideration. He wanted me to dive into it. And so that's what I did. And I figured I would dive into the data on compassion, or I should say, try to dive into it and find nothing there. Report back to him that, of course, compassion's always been in the art of medicine, and there's always an ought there. There was no doubt, of course, that there is a duty. We ought to treat patients with compassion, whether people are religious or not. I think the golden rule is something that could resonate in everybody's life. And of course, we ought to treat patients with compassion, but I didn't think that there was any compassion effect, so to speak. So I thought that I would find nothing, report to him as such, and then go back with my brain injury research in the ICU. And imagine my surprise, our surprise, to find that where conjecture and anecdotes and stories once reigned, now there was actually bona fide evidence that compassion matters not just in meaningful ways, but also in measurable ways. That compassion has measurable beneficial effects for patients, for patient care, and even for those who care for patients. And so we synthesized all that evidence. We put it into our first book, which the title is Compassionomics. That's the moniker that we use for the science of compassion. And then just a few years later, we took a dive into the evidence that compassion is not just good for the giver if you put on scrubs and go to the hospital every morning, but it's good for everybody. And we wrote a book called Wonder Drug about the scientific evidence that serving other people is the best medicine for yourself, not just for your physical health and longevity, but for your mental health, your well-being, even your professional success.
Love it. So as you were talking, you reminded me of a quote from last time, and I don't want to get it wrong, but it had to do with what is the art and science of medicine, right?
Yeah, so there's no doubt that compassion has always mattered, but our question was not from a through a moral or ethical lens, or a philosophical, theological lens, or an emotional, sentimental lens. We wanted to put it under the scrutiny of science and examine compassion through the lens of science. And while really the question is there also science in the art of medicine? And what is the evidence? And so what we did is a quasi-systematic review of over 1,000 scientific abstracts. We cited 280 original science research papers in Compassionomics and 250 more in Wonder Drug, and dove into the evidence that compassion is not just a nice to have. It's not the cherry on top of the sundae. It is actually fundamental to good health and healing, and there are biological effects of compassion, not only for the receiver, but for the giver too.
Okay, so powerful evidence, and maybe for one nice way to bridge last show to this show is to talk a little bit about the power of 40 seconds. And I think you had, it was built into one of your TED Talks.
So the most striking piece of data that Dr. Maz and I found in our work on Compassionomics was this, the number 56. That was the proportion of physicians, according to a study published in the Journal of General Internal Medicine, that said that they don't have time to treat patients with compassion. 56%. Of course, it begs the question, how long does it actually take? And so researchers from Johns Hopkins wanted to know the answer to that question. And in a sample of 210 research subjects, the vast majority of whom were survivors of breast cancer, they tested a compassion intervention. And I'm going to describe that in a moment. But first, I need to tell you the primary outcome measure for this study. The primary outcome measure was a well-validated scale of a patient's anxiety. And if you've ever had cancer or someone close to you has had cancer, you know that anxiety is a pretty important outcome measure. And so the experimental design of this study was randomizing among these 210 breast cancer survivors. Half of them were randomized to an information-only consultation with an oncologist, a cancer specialist. And the other group was the enhanced compassion intervention. And what they found is that the enhanced compassion intervention from the oncologist, it was the same information with just a little bit more. It not only reduced a patient's level of anxiety, it did it to a statistically significant extent. So what was the intervention? It was this. So at the beginning of the consultation, the oncologist said, I know this is a difficult time for you, and I want you to know that we're here together. I want you to feel comfortable in stopping me if anything I say today is confusing or doesn't make sense. We're here together, and we'll go through this together. And then at the end of the consultation, the oncologist again said, I want to emphasize again that we're in this together and I will be with you each step along the way. So how long did that take? Well, they measured it. It was 40 seconds. Now, could it take longer? Well, of course, it could. But if we want to be evidence-based about it, the minimum dose, so to speak, is just 40 seconds. To not just make a meaningful difference for a patient, and in this case, their level of anxiety following cancer, but also a measurable difference. And so some of my colleagues here at Cooper will say to me, there should be no time dimension at all. I mean, forget 40 seconds, because you can go through your day with brusque efficiency, letting everybody know exactly how busy you are or how busy you think you are in your mind, or you can treat patients with compassion. And if we held a stopwatch to you, there would be no difference at all.
So statistically significant, 40 seconds can make an impact in someone's lives, and it directly connects to their level of anxiety.
It was in their level of anxiety, and it didn't eliminate it. I want to be crystal clear about that. It didn't necessarily go to zero. But what it did was make a reduction, a measurable difference, and one that was statistically significant when compared to the information-only consultation from the oncologist.
So then you wrote the follow-up book, The Wonder Drug. And so if compassion is the wonder drug, how can business leaders operationalize it without diluting the authenticity of it?
So there are a couple things that we need to have as a precursor. Number one is we need to realize that there is, in fact, an evidence base for compassion. We have to realize, number two, that we can get better at it. So I didn't believe that before I started doing this work. I thought people were either wired for compassion for others or they were not. That's not evidence-based. To be fair, to some extent, perhaps it is. Many research studies have shown that there are genetic polymorphisms that may be responsible for perhaps a quarter, maybe even a third of one's propensity for serving others. But the corollary to that, of course, is that the majority of one's propensity is not. In realizing that how we show compassion for others, these are behaviors, and these are skills. It's not something in the fabric of who you are or something that is a trait. And so if we have a growth mindset, realizing that these are traits and skills, rather than a fixed mindset where we would think, well, I'm not a touchy-feely person or I'm not like that. Those are not only cop-outs, those aren't evidence-based statements. So we have to realize that the trauma alert, Mark.
Really enough.
So we just have to realize that not only can we get better at compassion, what the research shows on the growth mindset as it relates to compassion is that the people who have a growth mindset, realize that behaviors are skills and that skills can be learned, those are the people who will not only get better at compassion, they'll get better at compassion for others when compassion is hard. And sometimes compassion is hard. Those are the people that'll put in the work. Lastly, is realizing that there really should be no time dimension for compassion. Much of that time dimension, we're all in a rush, is oftentimes mostly in our heads. So what we did is we studied the scientific evidence that if someone takes on that mindset, and we lay out actually 7 scientifically proven ways in Wonder Drug to get better at serving others, meaning that these are tactics that can be employed. Those are the ways that we can get better, that we can raise our game, so to speak.
So whether it's those 7 ways, which are no doubt are going to have an impact if done correctly, I want to ask, if I'm the business leader, should we measure compassion the way hospitals track, let's say, clinical outcomes, or would that just be kind of missing the point?
So our research group here at Cooper, we've done 5 different studies now in 13,000 patients, validating what we call the 5-item compassion measure. So a very brief, efficient way to measure specifically compassion from the experience of the patient. And so these are things asking you questions like, did they take care of your emotional concerns? Did they actually listen to you? Were they able to gain your trust? All the things that you might expect. But this is as well validated from a psychometric standpoint as any other measure in the domain of healthcare. I think that's a safe statement to say. And we also are collecting data in our research on specific behaviors. So what we want to be able to do, at least semi-quantitatively, is to be able to tell learners, so medical students, physicians in training, these are the very specific behaviors from the patient perspective that are most closely associated with patient experience of compassion. So rather than telling a young trainee or a student, whether they're physicians or nurses, to just go in the room to see that patient and try to be more compassionate, that's not always very helpful. What we want to do is give them the 3 behaviors in a certain context or with a certain patient profile. These are the 3 specific actionable steps that you can take that will increase the likelihood that your patient will be experiencing compassion from the care that you. In other contexts,
Yeah.
You mentioned business leaders, we could apply that research methodology. We just happen to be starting in healthcare.
Yeah. So if you think about the impact of the experience in healthcare and patient, as you shared, oftentimes it's you shared some of your own work has been either, I guess, the ICU, ER. If you're dealing with breast cancer patients, it could be the worst day of their lives. It could be the worst information they're ever going to get in their lives. But what I want to impress upon people listening who may not be in healthcare is there's still a huge impact, even if it isn't a life or death scenario, right? The impact of compassion. Do you want to speak to that?
People are very good at putting on their poker face. So today you may have been standing next to somebody in the line to get coffee who, from the outside, from your vantage point, you can't tell anything at all, but they're doing their absolute best not to completely fall apart. When you meet somebody in that moment, whether it's in a line for coffee or in my ICU, and you show them compassion in the time that they need it the most, not only will they perhaps never forget it, what I can tell you from our work is that it reverberates, it echoes, it goes on and on. And I'm very interested in the question, what do patients and their families remember? But I can tell you not only from data, but also just from doing life for 50 years or so now, that there is, when you meet somebody in that moment, that it can be life-changing for them, something they'll never forget. When you think about the power of that, you think differently about your opportunities to treat people with compassion and your opportunities to serve others.
Every
you don't
touch
need
point
to
matters,
change your field and go to healthcare.
Customer
You
journey
definitely
can be
don't need to
challenging,
quit your job,
especially
sell
for
all your worldly
enterprises due to
possessions, move
disjointed
to a third
data,
world country and start
difficulty
hauling
aligning
water from a
stakeholders,
distant
and
well.
struggling
You
to
don't need
secure
to do
executive
that.
support.
You can start
And
small.
that's where
So
Journey
not by
Track comes
changing
in.
your
Journey Track integrates
experiences
journey
or not
mapping
changing your
management
surroundings,
and
but
measurement,
rather
allowing
changing
you
your
to pinpoint
experience
friction,
of your
optimize
surroundings,
experiences,
and looking
and
for those
demonstrate the
people
ROI
who may
of
be in
CX
need.
initiatives.
Research from the
So you
University of
can
Toronto
align
has
teams,
recently
break
shown
down
that in
silos,
everyday
and then you
life,
can track
regular people, I'm
improvements
not talking about
in
healthcare
real time.
workers, in everyday
With Journey
life,
Track,
we have
you can get visibility across every channel
opportunities
and
for
touch
empathy
point.
every
No more
day.
guesswork.
Huge.
Just clear
Huge.
insights and measurable
makes
results.
I
Join
think
the
of
CX
that
leaders
often
who
because
transform
it makes
journeys
me
into
wonder,
improved
how many
experiences
opportunities
with
did
impactful
I
business
already
outcomes,
miss today?
like reduced churn and increased customer
And
if you're listening, I mean, so much journeytrack.io
rich information
here that you're sharing. If you're listening and you're not in healthcare, just extrapolate the information that you're sharing. I had on my show Jason Barrow from Bain, which he developed something called NPS Prism, and that's a huge database where they can take a look by industry and understand, as he described it, what levers to push and pull to differentiate amongst your peer group of competitors, right, in terms of giving the customer a better experience. And because you don't need to pull every lever. But in this case, what we're talking about is understanding that a lever that's likely to make an impact, as it's now, you're sharing evidence-based, is that one where we have that interaction with the customer. It's most, and correct me if I'm going off base here, but it's most prolific when we're actually dealing live, either like you and I are talking through a video conference or even on phone. But even if it's something that's digital, which more and more of our experiences with organizations are, understanding how we can show compassion can make a huge difference.
Absolutely. So I'm thinking about a paper that was published in JAMA Psychiatry just a couple of years ago. And it was a study that was conducted during the pandemic. And what they did is they trained, and I want to say the pandemic was hard for everybody, but it was especially hard for the population of subjects that they studied in this research. They were elderly people who were all alone.
Yeah.
And clearly they suffered in a very heightened or unique way.
Yeah.
And so what they did is they trained lay people. These weren't psychologists. They were anybody who just volunteered to do this important work. And of course, they couldn't go visit these elderly people because of the pandemic and risk for infection, et cetera. But they would call them weekly and just have conversation and relationship. And what they found, and to be clear, they were trained in how to communicate with them and to show support and to ask the right questions. And there was a protocol, okay? But the training was not complex. And what they found is that the intervention of these lay people, trained lay people, calling just once a week to build relationship was associated with a decrease in loneliness among the elderly subjects of this study. Now, what's most striking is when they measured the length of these phone calls. And this is where you may have heard some talk about this research before. On average, it was 8 minutes.
Wow.
8 minutes. So if we want to be evidence-based about it, in order to reduce loneliness, of which there's validated scales for this, and if we want to reduce it in a not just a meaningful but a measurable, statistically significant reduction in loneliness, all it takes is 8 minutes. And so some people have popularized the idea is that when you're feeling alone, right, and you can feel alone in a crowded room full of people. But when you're feeling alone and you need to reach out to somebody, a question to indicate that you're feeling alone and you need something from that other person is, do you have 8 minutes? And that's something amongst some of my colleagues here at Cooper that they've been doing. So when we've got people on our teams who are struggling, whether they're feeling alone or they're just going through something tough and they need some support, a question to indicate that in a safe way is, you have 8 minutes. And I'm a firm believer that within healthcare, and I have data for almost everything except this one specific thing that I'm going to tell you right now, because I've just seen it over 25 years now of working in the ICU. But if we do a better job taking care of each other, how we take care of patients will be just fine. Just fine. Similarly, if you're asking broadly for business leaders, I think if we do a good job of taking care of each other, do a better job of that perhaps, we will do a better job of taking care of those customers that we serve, the clients we serve, of anybody that we serve. And I just think that it raises the norms, so to speak, in an organization. I know that it has here in our organization here in Camden. It raises the norms for helping and serving and making connections. And by extension, I think that the people, the clients, the customers that we serve can feel that.
So it all sounds lovely, and there's no question that you've already won the hearts and minds of change leaders, many of which have been trying to beat this drum, whether it's this specific area of improvement for their customers, patients, guests, passengers, whatever, or another area. The question I want to ask, it seems like you've got maybe fertile soil at where you are in Camden, New Jersey at Cooper, but many CX and PX leaders struggle to get executive buy-in. So what advice do you have for change leaders who are trying to capture the attention, maybe some budget dollars, and other resources from the C-suite to implement compassion-based training or interventions?
So when I speak to groups, there is one very specific role that I get this next question from, and it's the CFOs. And the question is, what is the ROI, return on investment, of compassion? It's a fair question. I'm fine with the question. The ROI is this. The number one expense at my organization, and probably most the organizations and most of the people that are listening today, is people. And when we lose people, when we have attrition, it is incredibly expensive. I have hundreds of physicians in my department that I'm the chair of the Department of Medicine here. And so I can tell you that there are data on this for physicians. And the reason why it's so expensive is, one, if a physician leaves for whatever reason, they have to wind down their practice. Then you have to go recruit somebody. You might have to pay a premium for that if you're having trouble recruiting. Then the person you recruit, by the way, during that time of winding down and recruiting, there's more stress left on everybody else who is absorbing the extra patient volumes, which takes a toll. That one part's hard to measure, but there's a toll there. And then the next physician that you recruited has to ramp up their practice to full scale. Broadly, researchers have found that it's typically $500,000 to $1.5 million. I recognize that's a large range, but it's not small dollars for just one physician attrition. You can apply that to other roles in healthcare or in other industries as well. Attrition is incredibly expensive. Okay, so now let's go to the payoff. McKinsey and Company, obviously a huge international business consultancy, has studied extensively on attrition, risk of attrition, and they've done this across many different roles, actually across many different industries, but also within healthcare. And so the data that's front of mind for me right now is data on nurses. And what they found is that 40% approximately were at high risk for leaving in the next 24 months, either leaving their current employer or leaving healthcare completely. And so they asked the employers, what are the primary drivers of the risk for attrition amongst these nurses? And the employers said, what do you think they said? So pay, right? And workload. And those were drivers. I mean, those things mattered, but they weren't the sharpest discriminators. The sharpest discriminators were two things. Number one, having caring and trusting teammates. And number two, having a sense of belonging. So how we care for each other and developing what we like to think of as a compassion culture, not just for the patients or in some industries, clients or customers, but how we take care of each other. The payoff, so to speak, or ROI, if you will, is that we hold our teams together. And holding our teams together is vitally important, not just for the cost that it represents when you have attrition, but also for quality, because we can't afford to lose anybody, especially people who are good. So the ROI or the payoff mark is in holding our teams together.
Huge. And it makes perfect sense. And it does translate across industries outside of healthcare. And I think in this day and age, generally speaking, I think we have more turnover in organizations than we ever have for a variety of reasons. So there's costs associated with it. If you're a change leader, there are several areas that Dr. Trzeciak talked about in this conversation where you can dig into and, work with your financial team to sharpen the pencil and get clear on some of the calculations that are relevant in your organization to make the business case. But it's there. And one of the things that I'm hearing from you in all of what you're sharing is that it's hard to implement organizational change from the standpoint of shift people's thinking, but the solutions aren't rocket science. They're not throwing millions of dollars at trying to get something to change, right? I mean, these are things that can be done.
Yeah. So the Gallup organization, and they know what they're doing, right? So they have been around for a long time, and they know how to get representative samples and to get data that is actionable. And so they did a study that was just published in 2025, and the title of the report was, "What is it that followers want from their leaders?" And they interviewed 30,000 plus people over 52 different countries. So it was an international, very broad sample. And they asked people to first think of the best leader they ever had in their life, the most influential in a positive way. So it could be anybody. It could be their current boss. It could have been a mentor from early in their career. It could have been a little league coach, or it could be a parent or a sibling, anybody. But then once they thought of that person, they were asked a question, what quality of this leader made them the best leader that you've ever had? And then they used their methodology to adjudicate all the answers, sometimes qualitative answers, into buckets, so to speak. And they found that there were 4 main things that followers were looking for in their leaders. Number 4, steady. Makes sense. No one wants an erratic, unpredictable leader, right? Number 3 was trust. Totally makes sense, right? You want to be able to trust your leader. Number 2, wait for it, compassion.
Ooh, there you go.
Not unexpected either. If you're going through something hard, and we all will at some point, you want a leader who's not only going to be there for you, but to also care in a very real way. Makes sense. But then what they found is that number 1 outweighed numbers 2, 3, and 4 combined. Do you want to guess? I'll tell you. They wanted a leader who inspired hope. That is what characterized the leaders that meant the most to them throughout their lives thus far. When we talk about hope, first of all, I think hope gets a bad rap. In business, sometimes you hear this saying, hope is not a strategy.
Right?
Yeah, but hope is also necessary for every strategy. So I don't necessarily buy in to that, to any cynicism or skepticism around hope. I think hope is powerful. Dr. Maz and I are actually studying that right now for our next book to come next year. But we're not talking about Pollyanna, rose-colored glasses, kind of, everything will be okay kind of hope. We're talking about real hope. And real hope acknowledges that things are tough. There's a radical acceptance of the reality, and yet a realization that we're going to be able to see this through. Why? Because you are the right people. The people in this room are the right people for this moment. You're all here because you've been handpicked, and I wouldn't want to go through this challenge we're in with anybody else.
Love it. Love it. Well, there's your teaser, folks, for the next time I have Dr. T on the show. We'll be hopefully digging a little bit into his next book, all about hope and how we can learn from it and gain some insights. Hey, before we wind down here, I got a couple more questions I want to end with. And last time, it just occurred to me to ask you this question because of what you have done in your background. So I will share I'll give the spoiler alert away. At the end of that episode, I asked him one tip for anyone if they should experience someone having a cardiac arrest. And what should they know about it? And you said nobody's really asked me that question before, and I felt good about that. But I want to ask you, maybe at a little more general level, about one question about compassion. You wish more, whether they're journalists or podcasters, would ask you, but rarely do.
Well, first of all, you just reminded me to go back to the answer I gave you, and that is learn CPR. I did over a decade of brain injury research after cardiac arrest, and there are lots of things that can make little differences. But
trauma admitting, trauma alert.
Another trauma. Sorry for the interruption.
No, it's okay.
But the one thing that makes the biggest difference is whether or not the bystanders at the shopping mall or the sports arena or wherever, supermarket, wherever the patient collapsed, whether or not they did quality CPR. Anyway, that's not what you asked me. So what's the question that people don't ask me that I wish they asked me?
Relative to compassion.
So I have so the question would be, give me one. I don't like the word hack, compassion hack. I don't like that word, but what's a tip, that you might use? I don't think I talked about this the last time that we were on the show, or that I was on your show, but I have a colleague who's a cardiologist who's crazy busy. Does this sound familiar at all?
Well, I don't remember, but it's worth repeating. Okay. I could tell you already.
So I visited him in his office, and he's so busy. I said, this place is mayhem. The phone's ringing, the insurance company's calling, the family of the patient is calling. It's standing room only out here. How do you... But I knew that he was famous for rapport with patients and had all the data to prove it. Patients, how do you do it? And he said, well, listen, he said, I get stressed like everybody else. But what I do, and he says, I've been doing it for so long now, more than 30 years in my career, is I don't even realize I'm doing it anymore. But this is the thing. It's the doorknob for me. That's the doorknob going into the exam room. It was his cue to remember this, that the patient might have been waiting weeks to see him. Perhaps they're nervous about a test result. It could be all sorts of different things. So what the doorknob would remind him is this, that no matter all the craziness and just the hectic mayhem that was going on in the office because it's so busy, when he put his hand on the doorknob, it was his reminder that his only job over the next 20 minutes or however long the visit was going to be. His only job was to make that patient feel like they're the only person in the world.
If you're listening, what's your doorknob?
Yeah, so when he says, I get stressed just like everybody else. And I do it because when I make patients feel like for that short period of time that they're the only person in the world, yes, it's meaningful for them, but it's also why I still like my job. No, I'm sorry, not love, he said. It's why I still love my job and want to keep doing this for as long as I can, despite all the chaos of a busy cardiology practice. In the ICU, we don't have doorknobs. We have sliding glass doors. But what that represents is that there is a threshold of going into the patient room from the hallway. And so when I cross the threshold now, that's my cue to remember that whether I'm talking to the patient or if the patient can't talk and I'm speaking with the family, my only job in whatever amount of time that I'm going to be in there, my only job is to make them feel like they're the only people in the world. Ever since I started doing that, I started having more meaningful connections with patients and their families, and it has made me love my practice and want to keep doing it for as long as I can.
Wow, that is super, super powerful. And if I recall, I think you might have mentioned a shift that you had in your own career where you were feeling, like many physicians do, burnout. And when you started focusing more on others and giving back to others, it really shifted your meaning and purpose in what you do. All right, fantastic. So many gems here, but you can pause and listen to it multiple times if you need to, and go back and listen to episode 102. But before we say goodbye, I've got one more question to ask that I ask all my guests, which I hope I don't blindside you, but it's a pretty easy question. What delights you as a customer?
What delights me as a customer?
Yes.
What delights me as a customer actually aligns with a research study that my group just published. We use machine learning to test which one of 27 different behaviors was most closely associated with a patient's experience of compassion. Behaviors by the doctor. And there were many findings in this research study. That study is also published in the Journal of General Internal Medicine, if anybody wants to look it up. But what we found was the number one thing, and this is not going to shock anybody, okay, is that the patient feels like the doctor actually listened to what they had to say.
Okay, yeah.
So what delights me as a customer is when I feel like people aren't going through the motions and they actually listened to what I had to say, even if they can't fix my problem.
Yeah.
They actually listened because it's a key component of empathy, which is the sensing, feeling, detecting, and understanding component. Compassion goes beyond empathy to then take action to alleviate a person's pain, suffering, or struggle to whatever extent is possible. But if you don't actually listen, then you can't have empathy, and empathy is vital. Because if you don't have empathy, you will miss 100% of your opportunities to respond to people with compassion.
If you don't have empathy, you'll miss 100% of the opportunities to respond to somebody with compassion.
You'll miss it completely.
Yeah. What a great episode. What a great time. So grateful to have you back. And thank you so much for taking time out of your busy schedule to join us again on the Delighted Customers podcast.
Thank you, Mark. I really appreciate it.
Hey, YouTube viewers. Thanks for watching the Delighted Customers podcast here on YouTube. If you found value in today's conversation, I'd really appreciate it if you'd hit that subscribe button and ring that notification bell. That way you'll never miss our weekly episodes with industry leaders sharing their strategies and insights that can transform your approach to customer experience and change leadership. Your subscription helps us reach more professionals like you who are passionate about creating meaningful change in their organizations. Thanks for being a part of our community, and I'll see you in the next episode.